What are the benefit limitations in Medicare Advantage Part C plans? Imagine getting all the benefits of Medicare but with some important rules to keep in mind. That's what Medicare Advantage plans, also called Part C, are all about. These plans are offered by private insurance companies approved by Medicare. They must cover everything original Medicare covers, like hospital stays and doctor visits. But they often add extras like vision, dental, or fitness programs. Still, there are some limits to what they can do. First, most Medicare Advantage plans use provider networks. That means you usually need to see doctors and go to hospitals within the plan's network to get full coverage. If you go outside the network, you might have to pay more or get no coverage unless it's an emergency. Some plans, like preferred provider organization plans, let you see out-of-network providers but at a higher cost. Another key point is the annual out-of-pocket maximum. Once you reach this limit, the plan pays for all your covered services for the rest of the year. For 2024, the federal maximum is $8,150 for in-network care and $13,300 if you include out-of-network services. Many plans set their limits lower, which helps protect you from very high costs. But remember, this maximum doesn't cover prescription drugs, which have their own cap under Part D. Cost sharing is another factor. Most plans charge a monthly premium, which is in addition to your Part B premium. You may also pay co-payments or co-insurance for services. These costs can vary a lot depending on the plan. Some plans might even have $0 premiums, but you still pay the Part B premium. Medicare Advantage plans do not cover everything. They won't pay for services that Medicare doesn't consider necessary. They also usually don't cover the Part B deductible unless it's listed as a benefit. If Medicare or another government program would pay for a service, the plan won't pay twice. There can also be waiting periods for pre-existing conditions, especially in the first 6 months of coverage, unless you had prior creditable coverage or are switching from another Medicare plan. Your choice of doctors and hospitals can be more limited with these plans. Health maintenance organization plans often requiring you to stay in the network, while preferred provider organization plans give some out-of-network options but at a higher cost. Networks can change each year, so it's a good idea to check your providers before enrolling. Many plans offer extra benefits like dental, vision, or hearing coverage. But these benefits are not standardized and can vary a lot. Some plans might limit how much they pay for these extras or how often you can use them. It's important to review each plan's details to see what's included. If you have other coverage like Medicaid or employer insurance, rules can be different. Usually, you can't use a Medicare Advantage plan alongside most other supplemental coverage. When choosing a plan, think about whether your doctors and hospitals are in the network, what prescription drugs are covered, and what your maximum out-of-pocket costs are. Review your plan during the annual enrollment period because benefits and costs can change each year. To sum up, Medicare Advantage plans give you benefits similar to original Medicare but with some limits. These include network restrictions, cost sharing, annual out-of-pocket maximums for medical care, and limits on extra benefits. Knowing these rules helps you decide if a plan fits your health needs and budget.